Medical Director, Dr. Rebecca Sunenshine, with us this evening. So we'd love to hear from you, and if you'd like to get in the queue to ask a question, please press *3 now. So again, please *3 to ask a question. So Ms. Flanagan, Dr. Sunenshine, welcome, and thanks so much for spending some time with the residents of District 3 this evening.
Thank you for having us.
Thank you for having us. We always love to have opportunities to interact with the community and help support our supervisors in efforts like these. So thank you for inviting us.
Well, thank you. Again, if you're just joining us, thanks for participating in District 3's COVID-19 Teletown Hall. And if you'd like to join the queue to ask a question, please press *3 now. So first of all, I'd like to start this evening by just thanking both of you and your team for the incredible work that you all have done in leading Maricopa County's response to COVID-19. A lot of people don't realize that our public health department is actually the 3rd largest in the country. And you both just do an incredible job, so I just really appreciate your dedication to the residents of District 3 and our whole county and the families. And, I mean, what you're dealing with is, as we all know, unprecedented, this pandemic that none of us could have imagined, and we've had so many unknowns. So, again, I just, on behalf of everyone, just want to thank both of you. All right, so with that, let's go ahead and jump in to a question. Dr. Sunenshine, I have this question for you. A lot has been said. I think we're all kind of following the case numbers day by day, and we've seen a decrease in the number of positive cases of COVID-19 in Maricopa County. Can you talk a little bit about it and what has been causing that?
Sure. So we've had close to 130,000 cases overall. But what's important is how many new cases we're seeing every day. And we've gotten down to the point where we're seeing fewer than 500 cases per day, whereas at the peak of our outbreak, we were seeing over 3,000 a day. What's important about those numbers is, as people have heard, the vast majority of them are in the 20 to 44 age group. Those people tend to get less sick, less symptomatic, and are less likely to be hospitalized or even die from COVID. Right now, about 11% of people who get diagnosed with the disease go to the hospital, about 1% experience some time in the intensive care unit, and then 2% approximately do succumb from the illness. What's important about the trends, though, as you mentioned, is that they have been continuing to go down, and that started almost exactly 2 weeks after the Maricopa County Board of Supervisors unanimously voted to have a mask requirement in place. And we know it takes about 2 weeks for any change to make a difference, and just 2 weeks after that June 20th mandate, we saw the cases flatten off and then drop down precipitously. So now we actually saw even more of a drop than we expected. So we're pleased to say that we're now back at a level that we were several months ago, and it continues to go down.
Well, that really is great news, and thanks for walking us through all of that. Director Flanagan, contact tracing and case investigation have been talked about a lot during COVID-19. And I'd love for you to talk a little bit about the innovative work that Maricopa County Public Health has done as it relates to the especially those large number of cases that we've had, and dealing with those needs of the pandemic, and actually how other big cities and counties have looked to us to kind of maybe model that sort of innovative approach.
Yeah, absolutely. So in Maricopa County, early on, we wanted to make sure that we were being as responsive as possible in the pandemic when we were doing our case investigations and contact tracing. And we implemented technology and the use of technology as much as we could. So all of our cases currently are positive cases that we receive from Arizona Department of Health Services through an electronic medical reporting system. Those are classified by county. We're able to log into that, and all of those cases within 12 to 24 hours of being the positive notification coming to us, we send out communication to them. So we completely contact all the people that we have information to reach out to them, and we reach out to them with 3 times using 3 different modalities. That can be an automated call, 2 text messages, a human phone call, and standard mail. So when we reach out to them to do our case investigations, we start collecting medical information from them and also information about their close contacts. And we use this digital platform to send out text messages asking individuals to go into that text message, start pre-filling out information, and give us the information of their close contacts. And the CDC actually says that digital contact tracing improves the efficiency and the accuracy of data management and reduces the burden of data collection on public health staff. And this is by allowing electronic self-reporting by cases and contacts. The contacts, we then transfer those over to AZ211, who enrolls all of the close contacts into a SARA alert monitoring system. And what the SARA alert system does is it has close contacts have a daily check-in and report of their symptoms. If they become symptomatic, we reach out and we start asking those individuals to go get testing to see what their symptoms are. So if they are becoming infectious, we get a hold of them right away and get them in for testing. Also, AZ211 is great at providing social support and connecting these individuals with resources. So that allows our epidemiologists and highly trained staff to really focus on the high-risk cases and that they are directly contacted by Maricopa County Department of Public Health investigator. And as you mentioned, we've had requests from other cities and states and counties who have requested our case investigation and contact tracing efforts. Just to name a few, we've had the state of Alaska, Tennessee, Alabama, Reno, Nevada, Tarrant County, Texas, which is Fort Worth, Pima County in Arizona. These are some Arizona counties. Pima County, Coconino County, Pinal, Yuma, and Cochise counties. And also Dr. Burks, when she was here visiting with the Vice President, gave lots of praises to Maricopa County Department of Public Health for our efforts in using technology and the systems we've used for texting and contact tracing, and really gave high praises to how efficient our process was, and really encouraged and said that she would be sharing our process when she toured around the states, and we may be hearing from other jurisdictions that may want to incorporate how we are doing our process here.
Great. Well, thanks for walking us through that. I mean, contact tracing, I think, is something that, people hear about, but that really helps, I think, for people to better understand it. Just a reminder, if you would like to ask a question, please dial *3. Now, this is kind of back-to-school time, as we know, so Dr. Sunenshine, maybe you can talk to us a little bit about COVID-19, how the disease interacts with the community and school settings. I mean, obviously, we all know that kids learn best in the classrooms, but maybe talk to us about what could potentially happen if kids were to go into the schools too soon, go back in, for the in-class instruction.
Right. Well, we know some things about COVID-19, and we're still learning other things. And one of the things we know is that it spread primarily like the flu, with droplet spread. And we know with the flu that every time kids go back to school, that flu spreads very rapidly in a school setting. So we are already very wary that that's a place where lots of people are close together and they have the opportunity to interact. So the first thing that we want to do is we want to make sure that we're monitoring the rates of COVID-19 in the different areas of our county. And as part of that, we have provided a dashboard so that people can monitor that. So you want to make sure that there's not a lot of spread before you send kids back to school. And importantly, even when they do go back to school, there's a lot of things that we want to make sure are in place to minimize the amount of spread that it can occur in that setting. We know in the beginning we thought that kids probably didn't spread COVID-19 as much, but there's been 2 pretty big studies, or reasonable-sized studies, on kids. And we now know that kids of all ages can effectively spread it. So in order to prevent that from happening, all kids and staff need to be wearing masks while they're in school all the time. And it's important not only to have them wearing masks, but to really enforce that, especially since kids aren't always known to understand consequences that well. And then the other thing we need to do is make sure that we have processes in place so that kids remember to stay 6 feet apart, that there's lots of opportunities for them to wash their hands, use hand sanitizer, and frequent reminders about hygiene and making sure that they cover their coughs if they have them and keeping their masks on. And then I think the other critical thing is when they do go back is doing that daily screening for symptoms. And unfortunately, even though there's lots of things that have the same symptoms as COVID-19, like a cough or a sore throat or even just a stuffy nose, we're going to be extra careful this year that any symptoms at all that could be COVID, and the child really does need to stay home.
Thank you for that. Director Flanagan, now I understand that you've worked with the school superintendents around Maricopa County, and you put this task force together that actually helped give input to the governor's office and helped us to create the dashboard that Dr. Sunenshine referenced, which the school leaders are using to make informed decisions on reopening. Can you talk about that a little bit?
Yeah, so it was really important for us to make sure that we had heard from our superintendents from around the valley. We knew with the size of and number of schools that we have in Maricopa County, it was really going to be impossible to allow everyone to participate. So we divided the county up into regions and really tried to make sure we had representation from superintendents in each region of Maricopa County. And we brought them together for a school reopening work group. We had about 15 participants, school officials, and public health participate in this work group and really kind of talk through some of the benchmarks that the state was considering and what those benchmarks would mean for the schools, and then what resources and information could public health provide to superintendents to make informed decisions. So the decision of reopening a school isn't left up to public health. It's actually the decision of a school board and a superintendent, but certainly public health is here to help make them give them the data and the information that would make informed decisions and give them some guidance and recommendations. So if they were going to choose to bring students back onto campus, what they could do to try to do that safely and what infection control measures that they should consider. So that work group was a great starting point for us to really ask what kind of data would they want and how would they want the data to look. ADHS is providing data on a county-wide level, but we heard very clearly from our superintendents here that they'd like to see real localized numbers. So zip code, school district, and city data is everything that we decided to provide on our dashboard, and I think they really appreciate that.
Well, and I think that's great that you've been able to get that information to that level, and it's going to give our school leaders the information they need to make the best possible decisions. So with that now, we have quite a few questions that are in, so thank you very much for that. So we're going to go ahead and go to the first question here. If you can please tell us your name and your question. Welcome.
Hello and good evening. Thank you for your time today, Supervisor Gates. I think Dr. Sunenshine kind of tangentially touched on this, but I'm curious to know if we know how effective the mask mandate has been.
Thank you for that question. Dr. Sunenshine.
Yes. Well, what we've seen from other studies in other states and cities is that just about 14 days after you implement a mask mandate, that's when you start to see an effect. And almost exactly 2 weeks after the mask mandate was implemented, we saw our curve flatten off and then decrease sequentially after a period of time. We did go to ASU to try to predict how much it would affect, and they estimated that when the stay-at-home order actually expired, that we saw a 20 to 25% case increase shortly after that stay-at-home order expired. And they predicted, or they detected, an 18% decrease just 14 days after, but we've actually seen a much bigger decrease overall, even more than ASU predicted. And we continue to see those case numbers going down. So what happened was we hit that threshold when what you hear about is the R naught, which is the number of people that can be infected by one case. Once it gets below 1, then you start to see that rapid decrease, and we were highly successful in doing that.
Well, and that's really good to hear. But look, I think for all of us, nobody likes wearing a mask, right? We don't like going out and doing that. But what I've heard from both of you is that by wearing masks, we can begin to start to have somewhat of a normal life. So thanks for that input. Our next call we have, if you can go ahead and state your name and your question. Joining us. Yeah, I'm sorry, maybe just making sure, do we have somebody there on the line, and do you have a question?
COVID-19.
Excuse me?
Was you asking for me?
Yes, please. State your name and your question.
My name's Ronald Weston, and my question was, to what I understand listening to the news, that there was a possible cure of a shot that would help the COVID-19. He'd explained it'd be like squeezing your hand around it, and it couldn't breathe, and it would anticipate. It would leave, if I got that right.
So there are a lot of scientists and a lot of folks that are looking actively for both a cure and for a treatment for the disease and for a vaccine. And what we're seeing the most progress in is a treatment, and we've actually had one drug in particular that has been shown to shorten the duration of severe disease. So you're sick for less time, particularly when you're in the intensive care unit. And then they've also been working really hard on multiple vaccines. And what that would do is if you receive the vaccine, the concept is your body would produce antibodies to fight off COVID, so that if you were exposed, you would be much less likely to get infected and may not get infected at all. So we do think that there's a vaccine on the horizon. No one knows exactly when that will be, but we know that there's one that's actually undergoing testing right here in Maricopa County, and we're anxiously awaiting those results.
That's exciting, and I think that's, people love to hear that there's some hope, and there's a lot of smart people out there working on this issue. Our next caller is Donna Beal.
Yes.
Yes, Donna, thanks for joining us.
Thank you. My question is, I've heard a lot about herd immunity. I guess that means that a lot of the population has already had the illness. And is that what we're working toward in Maricopa County, or do we have a lot of herd immunity now, or what is going on with that?
Yeah, so herd immunity is near and dear to my heart. What it means is that enough people in the community are immune to the disease so that the disease can't spread effectively in the community. And most of the time we achieve herd immunity with vaccines. But you can also have a situation where enough people get a natural infection and their bodies naturally develop immunity, and you can achieve it that way. We originally, and the threshold, or how many people need to have immunity in order to reach herd immunity, changes depending on what disease you're talking about. So for measles, 95% have to be immune in order for it to be effective. With COVID-19, we originally thought that it was about 70%, but now we're seeing some new evidence that it might be as low as 30%. So what we're hoping for is that between the people who've gotten naturally infected And then once a vaccine comes out, we won't need to vaccinate as many people as we thought in order to reach herd immunity and then stop the disease from spreading effectively in our population. So that is what we're hoping for.
And more encouraging news.
Yeah.
That's excellent. Our next question is from Roxanne.
Yeah, I want to know if you've already had COVID-19 like I have and you survive, can I be spreading it again, or am I, immune to it all?
Great question, Roxanne. Dr. Sunenshine.
Yeah, that's a question that everyone is asking, including scientists. And what we know so far is that people who get infected with COVID-19 are very unlikely to get infected again, at least within the first 3 months and probably the first year. It just hasn't been long enough to know whether they can't ever get it again, but we do think you're probably not going to get it again for the first year. And we also know that once you get it, after about 10 days, you stop being infectious. So that's for people who get kind of a normal, moderate illness. If you're very severely ill, it's after about 20 days that you stop being infectious. So as long as it's been a few weeks, you don't have to worry about spreading it to anyone else.
So thank you for that question. And our next question is from Lillian Cito.
Hello, yeah.
Yeah, thanks for joining us.
Thank you. I'm an old woman, and I have raised children, grandchildren, great-grandchildren, and I've been all over this country, and Arizona is the only one that I know that takes their children back to school in August. When we have heard from the professionals that if we delayed it for a month or two, that it might reduce the number of children that would get sick. And so the only one that I can see that profits by taking them back in August is APS. And I would like to see nobody heard Condoleezza Rice last night on the Steve Coburn, and honey, what she had to say. But we've got what we've got right now, and I think we should listen to the higher ups. And you cannot take second and third grade children and tell them to sit 8 hours in the classroom and keep their mask on and don't touch each other, and it's lunacy. It won't happen.
Well, Lillian, thanks for your question, and these are exactly the types of issues that those of us on the Board of Supervisors are talking with these public health professionals about every day, and they're working so closely with the school districts to give them the very best advice. And I think, as you probably know, in the end, it is the school boards that are making those decisions. But we're here to give them advice and counsel, and but this is exactly what we're talking about, trying to find that right balance so that we can get back to a semblance of a normal life while keeping people safe. Our next caller is Rosemary Eller. Ms. Eller?
Yes. I'm 86 years old, and I really don't want to go for a test, but I wonder how I'm going to know when the elderly people are supposed to have it done.
Well, thank you for your question. I would tell you that it's not necessary to get tested. Certainly, if you feel safer just staying home, that's what we're encouraging right now, only leaving if you need to. I would recommend if you start to feel symptomatic or you are notified that you've been in contact with someone that is positive, that's when I would say you need to get tested. But you're not missing out on anything. If you haven't gotten tested but you're feeling okay and you're doing okay in your home, I would say continue to do that. If you do need to leave your home, wear your mask, socially distance whenever you can, use the hand sanitizer, all those prevention messages you've really been hearing from public health, do all of those, but we're not saying that everyone has to get tested. Some individuals that are out in the community a lot, whether they're going to work or school, because they feel they may be coming into contact with quite a few people, they do get tested. But certainly if you are safe in your home and not feeling symptomatic, there's no need for you to leave and go get tested.
Yeah, thank you for your question. Love the questions. Keep them coming. And if you would like to ask us a question, please dial *3. Our next question is from Margaret Hooks. Margaret, thanks for joining us.
Thank you for taking my call. I'm concerned about the inoculations. And I did hear you mention Bill Gates. Now, is he involved in working on this inoculation? And another question is, what is in it?
Sorry for interrupting you there. Were you finished with your question? So I just wanted you to, just so everyone understands, so my name is Bill Gates. I'm not that rich guy. I'm the supervisor for Maricopa County District 3, and there's 5 of us who are on the County Board of Supervisors, and I represent your area, and I've been here on the board for 4 years, and one of the most important things that we do is work with public health to give them the resources that they need and to get out important messages about issues like the COVID-19 pandemic. So I know people have talked about that other Bill Gates in COVID-19, but I'm your county supervisor, Bill Gates, that you're hearing from this evening.
So Supervisor Gates, thank you for that. So to answer the question about what is in the vaccine, there are a number of different vaccines that are being researched and being developed right now. And what they all have in common is that they try to take a piece of the virus so that your body's immune system will recognize it and think it's the virus and produce antibodies to fight off the virus when it gets exposed. So it's sort of a way of tricking your body into developing an army against the virus for when you do get exposed. And that's the concept behind it. A lot of people feel anxious because they feel like, oh, we're developing this vaccine so quickly, but the truth is the United States and a lot of other countries have been developing vaccines this way for many, many, many years. We use the same equipment that we do for other vaccines and the same concepts and the same science, and so we are very good at making vaccines. And when you have this many people focused on trying to get a vaccine as quickly as possible, they will make sure that it's tested and that it's safe. But I know that I am very confident that a vaccine is what is going to get us out of this and let us go back to our normal lives.
Thank you, Dr. Sunenshine. Our next question is from Terry Malarkey.
Thank you, Supervisor Gates. Good to hear from you tonight. I have a question, I believe, for Dr. Sunenshine. Back when this all started, there was a lot in the news about the evolution of the virus and the mutations that were occurring. And then as time goes on, they haven't talked about that so much. I wasn't sure if there was any type of scientific evidence that the virus has indeed become weaker, and maybe that's one of the reasons why the death count is down not only in the U.S. but Arizona and other places.
Yeah. So there definitely was a lot of talk at one point about a mutation in the virus, and we actually had some researchers here that were able to look at the molecular sequencing of the virus, and they did confirm that the strain that was circulating here in Arizona and in the United States seemed to be a little bit different than the strain that was originally circulating in China. The interesting thing is just because there's a mutation doesn't necessarily mean that the virus becomes more or less infectious or that it makes people sicker. So mutations can happen all the time, but they have to be a very significant mutation in order to change the way the virus behaves. And there are some people who believe that that mutation actually made the virus spread more effectively, and that's one of the reasons why we saw so much spread rapidly. And then I want to get to the part on seeing the fact that the death rate has actually decreased in the United States from the beginning of the pandemic to later on. And what most of us think is that the reason why you're seeing fewer people die from the disease is because the vast majority of people who are getting sick are younger, predominantly in that 20 to 44 age group. And if you're between 20 and 44, then you're much less likely to get seriously ill from COVID-19. You're far less likely to be hospitalized, go into the intensive care, and much less likely to die from it. So it's basically a shift in who got infected rather than much to do with the virus strain is what we think right now.
Right, thank you. Our next question is from Scott. Scott, thanks for joining us.
Hi, thank you. Well, I just had my father who passed away from COVID after being in the hospital for 6 weeks. And so hearing a lot of the positive things you are saying here tonight, I naturally have a lot of skepticism with some of the things that you've brought up. One of the things I have a huge amount of skepticism on your praising yourself on all the contact tracing and how effective that's been, where that is completely inconsistent with what Representative Stan has said, and even your own governor, who says that contact tracing here has miserably failed, in spite of the fact that there was a bunch of money given to the state for that. So I need you to reconcile your praise of what you're doing in contact tracing versus what's really happening in terms of on the ground and what your critics are saying. And then my second thing I want to ask is, there's no question that your mask mandate after the handcuffs were taken off of you by the governor has helped. But how do you enforce such a thing if things start reopening a little bit more and people start getting overconfident the way they did without wearing masks after the reopening?
So thanks for your questions. I'll take the mask one first, and then I'll turn it over to Director Flanagan on the contact tracing. But on the masks, this is something where law enforcement has been utilized, and they will be utilized if needed. Again, the number one approach is education. We want to encourage people to do this because it's the right thing to do, because it is helping to bring the cases down so that, again, we can get back to having a somewhat normal life. But law enforcement, you can look at the gyms. I mean, we haven't been involved in those at the county, but that's been also used for some of the issues with the gyms, etc. And also the restaurants. That is within Maricopa County, and if we see those issues there, we will address them as well. But again, we're asking for people to do the right thing, but having said that, we did take the step of passing the mask mandate, which made it clear that this was to be the approach countywide. And then I'll turn it to Director Flanagan.
Yeah, thank you for bringing up the points and talking about contact tracing, because it's important for everyone to understand that public health uses contact tracing for lots of communicable diseases, and it's one of those oldest tools we have in our public health toolbox, and it works most when we are able to effectively know every single person that's come into contact with someone when they are infectious. So think about, for instance, an STD. When someone has an STD and we ask them, who were all of your partners that you came into contact with during your infectious period, when we say potentially your infectious period was the last 2 weeks, it's easy for someone to recall that and to give us those names and the contacts of those individuals. When you think about COVID-19, there's a few things that are important to know. First is that there is asymptomatic spread. Early on in this pandemic, we weren't sure if there was asymptomatic spread. We were really going with the notion that people were symptomatic, that individuals that were getting sick is because they came into contact with someone that was sick. We now know that individuals become ill and they may not even know that they are COVID positive, and they come into contact with other individuals. So what the data has shown us recently is that for every one person that we know that is positive with COVID-19, there can be up to 10 individuals that are also positive that public health is never notified about. So what this means is that if we get that one case reported to us and say they have 5 contacts, we are able to effectively reach out to all those individuals that we have information for and do some efforts to help quarantine and isolate. However, you think of the 9 others that public health is never made aware of because they don't get tested or because they don't even know they're positive, and all the individuals they come into contact with. That's when you're at the height of a pandemic, when you are having huge numbers like we saw in mid-June, where we were having upwards of 3,000 cases a day. When you think of those 3,000 people, and to think there's anywhere of 8 to 10 for each one of those 3,000 that are also in our community that are infectious and potentially spreading it to others, you quickly realize that contact tracing is not the only answer. It's one of the things that we can do to help try to control the spread, but contact tracing is most effective when there is low community spread happening. And really what the CDC and the World Health Organization defines as low community spread is when there's only 5 to 20 cases happening in your community, which we haven't had that since early February in Maricopa County. So we have staffed up enough to be able to really handle a large volume of cases, but still it's important to know that contact tracing is complicated. It's only as good as when we call a case, they can tell us exactly everyone they've been into contact with when they're infectious. And also knowing that for COVID, we say it's 14 days prior. So I know for myself, I can hardly recall yesterday who I may have come into contact with, let alone 14 days ago and each of those days. So it is complicated. I would say overall nationally, contact tracing has gotten a lot of attention as the best thing that we can do, and we just like to caution everyone that it's a very important part of what we do, but it's not the only part of public health and the effort to mitigate this spread. And the biggest impact and effort is really when we can do those policy decisions like putting a mask mandate in place, which our Board of Supervisors did countywide. Those are going to have the biggest impact on the spread in our community.
And I do want to add, there's been a lot of talk about laboratory testing and turnaround time, and it is really important for contact tracing to be effective. Not only do you have to, it works best in the beginning of an outbreak, and once you have control of an outbreak, and we're heading into that zone now where contact tracing will begin to be effective again. And I'm grateful to say that our lab turnaround time, which was upwards of 8 to 10 days, is now down to a median of 2 days. So we have gotten that under control, and that's important because the amount of time it takes for someone to get their lab result back from when they get tested is a delay for when public health can notify all the people they expose. So when it was 10 days, public health wouldn't know about that person being positive for a week and a half to 2 weeks, and by then they'd already spread it. So now we're in a much better position for contact tracing to be effective due to the number of cases and the lab turnaround time.
Yeah, that's a great point. And again, if anyone else has a question out there, please dial *3. Our next question is from Ray. Ray, thanks for joining us.
Good evening. I only have 2 questions. One is, what is the current rate of community spread in Maricopa County? The second question is, where can the public go to get a test to find out if they've developed the antibodies? Thank you.
Thank you very much for that question. Appreciate it.
Yeah, if you are interested in where you can get testing, you can go to the maricopa.gov/coronavirus and find out about testing. You can also go to the Arizona Department of Health Services website, which is azDHS.gov/coronavirus, and it'll give all the testing locations, and it'll differentiate what kind of testing they do, whether it's the PCR testing, which is really diagnostic testing, or the antibody testing.
That's something, getting this testing up, that's something that Maricopa County has been working on, getting more community testing, as well as, of course, the state. Some of the localities have been working on this as well, so and even the federal government. So it's been a great all-hands-on-deck effort.
So looking at the rate in Maricopa County as a whole, we always have to go back a couple of weeks because we want to make sure that our data are complete. So we're looking at the week of July 26th to the week of August 1st, and at that time the rate was 125 cases per 100,000 over the week. And that, just to give you some context, that had decreased from the week before from 167 cases per 100,000. So that's a pretty significant decrease from week to week.
Thank you for that. Our next question that we have is coming in from Dawn Walker. Dawn, thanks for joining us.
Hi, Supervisor. My question is more in regards to privacy. I'm sure you're aware that all the university students in the state were required to prove they were negative for COVID before they could be living on campus. Number one, they weren't made aware of that until a week before move-in. And I'm just concerned that what's going to happen with this DNA database that the university now has on, I don't know, what do we have, 100,000 or more for sure, students in Arizona. And I want to know what you're doing to protect that. First of all, I don't agree with it because these are the same kids that have been locked down for 6 months, didn't get a graduation, didn't get a prom. Now they're told you can't come to college unless you prove you're negative. So that was kind of adding insult to injury already. But my real concern is with the privacy aspect. It's like, where does this end? Is it going to be, okay, next you need to prove you've had a vaccine before you can go on with your life and pursue your studies and your career? I just think it's a real slippery slope, and I think it's a data grab, and I'm not happy about it. I mean, we're paying a lot of money for this. I know we want it off campus, but I really think it's a reach.
Yeah,
so
thank
also
you for the question. I certainly appreciate that question and what she's asking about because we are trying to balance things here, right? We're trying to address the public health challenge of our lives. At the same time, our health information is our own private information. And so that's something I know that we take very seriously here at Maricopa County is balancing that, getting people the information that they need, but at the same time not disclosing that private information. We do not run the universities, so that's the state, under the Board of Regents. But and that's something I'll definitely follow up and try and learn a little bit more on that because, again, we want to make sure that we're hitting the right balance here between keeping people safe, but also we want to protect the privacy of people's information. So thanks for that question. Our next question is from Marjorie. Thanks for joining us.
Hello. I have a two-part question, please. What if the stay-at-home order was reinstated for, say, a period of 3 to 4 weeks? Could we not stamp out the reinfection rate? And secondly, is this, it's as if the government officials were swaying under the influence of political and financial pressure and not taking into consideration the goodness of the people. I mean, you doctors and officials wanted a more of a ban of staying at home, and you were overridden by the influence of the government officials. Is there some way we can resolve this?
Marjorie, thanks for that question. I mean, I can just speak to what we've done here at Maricopa County, and we're very fortunate to have these experts who we literally consult with on a daily basis. And I can tell you that here, at Maricopa County, we've all done what we've thought was right. The mask mandate, when we voted for that, not everyone liked that. And again, I don't like going out and wearing a mask every day, but we recognized that had to happen if we wanted to get back to a somewhat normal life. And so that's where we're very much focused. We did see the impact that a complete shutdown has. That has some negative, very negative impacts as well. So what we've tried to do here is blaze a trail where through the use of masks and other things, washing your hands and everything, we can go back to a somewhat normal life while keeping people safe. Dr. Sunenshine, would you like to address that?
Yeah, no, I really appreciate your question, because I think that there was a perception that we were picking the economy over people's lives. And I want to say, as a public health physician, that the answer from all of my training in infectious diseases and in public health and epidemiology, that it's so important for people to be healthy, not just to not have the disease or not have COVID-19, but it's equally important for people to be able to feed themselves, make a living, feed their families, and be able to stay in their jobs. And we know that when you don't have a job and when you don't have any income, that your health is also adversely affected. So in public health, what we try to do is we try to look for that balance that will allow people who can't afford to stay at home from their job, that have to continue going to work. And when you close restaurants and when you close things, a lot of people who are making hourly wages lose their jobs, and they become very unhealthy because they can no longer eat and feed themselves. So I, as a public health physician, was really looking for a way that we could decrease the spread of the disease like we did with the mask order, but allows people to continue to go to work and support themselves and at least do many of their daily activities. And so from a public health perspective, I think that we did exactly the most that we possibly could do as soon as we were allowed to do it and as soon as we had the authority.
Thank you for that. Our next question is from Pete. Pete, thanks for joining us.
Thanks, Supervisor Gates, for taking my call. I was wondering, what is the county doing to help those who have been impacted financially by COVID-19?
Well, thanks for that question, Pete. We're very fortunate that Maricopa County received CARES funding from the federal government, so we appreciate the support that our Congress people provided on that. But we've taken that and we've got several programs that we're running. One of the things is the economic impact that COVID-19 has had on folks. So we've put $30 million towards COVID crisis rental assistance. So this helps people who might be at risk of losing their homes or losing their apartments. This is going to help them make a real big difference. It's also impacted our small businesses. So we have set aside $23 million to go to those small businesses that have been impacted by COVID-19. Another thing, it's very sad, we heard from a gentleman earlier who lost a loved one because of COVID-19. And so for those people who have been impacted by COVID-19 economically, we've actually set aside a few $1 million to help them pay for burial costs. We also have a school support fund. We've been talking about schools a lot this evening, $20 million, so that we can give them the support, the schools, the administrators, the teachers, the nurses, the support they need to help the kids to get back to school in a healthy way. Also, we provided assistance to our fire districts out there. They're doing a lot here in COVID-19, like in our area at the Daisy Mountain Fire District. So we've set aside $5 million for that. And then, of course, you heard us talking earlier about contact tracing, testing, case investigation. We've set aside $75 million for that. So there are many big challenges out there, but at Maricopa County, we've really tried to tackle it and give people the support that they need right now. Our next question is coming in from Kathy Swanky. Kathy, thanks for joining us.
Hi. My question is, vaccines are often unreliable. The strains of the virus changes. Hydroxychloroquine with Z-Pak and zinc has healed many people. I would like access to this treatment, and my doctor, he would like to be able to prescribe it. Why haven't you mentioned this promising treatment?
Well, I've also heard some of these things that you're saying about hydroxychloroquine and Z-Paks, and what I can tell you is that they have been looked at, but the studies that have been done, the scientifically rigorous studies, have actually not shown hydroxychloroquine to be reliably effective. So we have the Food and Drug Administration who very rigorously tests medications before a drug company is allowed to say that a medicine is effective at treating something, and we have to have scientifically rigorous trials to show that the drug is not only effective, but also that there are not significant side effects. And so with hydroxychloroquine, it has not been shown to be reliably effective, and we know that there are severe side effects to the drug. So we're not at a point where I, as a physician, feel comfortable recommending that drug, and the FDA has not yet approved it for those purposes.
Right, our next question is from Jody. Jody, thanks for joining us.
Hi, thank you for having me. My question is just how accurate are these numbers on cases and deaths that we're receiving, because we were led to believe that on the news that Washington mandated that the hospitals report all the cases directly to them, and then they will feed back the information. So how accurate is all this information that we're getting?
Yeah, that's a great question. We are lucky in Arizona that we have a few ways that we can get data reliably, regardless of whether it's reported directly to Health and Human Services in Washington or CDC. But here in Arizona, it is required by law that every positive test for COVID be reported to the Arizona Department of Health Services, and that's reported through an electronic system that Director Flanagan described before. So we learn about every single case that is diagnosed because it's reported to public health. When it comes to hospitalizations, that's a little bit trickier. We used to have to rely on being able to get a hold of someone to find out whether they were hospitalized. But a few weeks ago to a month ago, the Arizona Department of Health Services started receiving reports directly from hospitals where anybody who was infected with COVID-19 and was in the hospital was reported directly to the state health department. And that's when we saw our percentage of hospitalizations increase. It went from about 4% up to 11%. And we believe that those data are much more accurate because when we didn't have to rely on being able to talk to someone who was hospitalized to learn that they were in the hospital, and the hospitals reported directly to the Arizona Department of Health Services, then our data became much more complete. And so I do believe that about 11% of people who have COVID-19 and who are diagnosed positive are hospitalized at some point in their illness. And that's regardless of what the federal government is doing with the data.
Thank you. Angela is next for us. Angela, your question.
Yes, thank you, Supervisor. I had a question. If I already got tested and it was negative, am I immune or am I still susceptible? How do I know that?
Yeah, that's a great question. If you are tested and you test negative with the PCR test or the swab that's in your nose, all that means is that right now at this particular moment you're not infected with the virus. But it doesn't really tell us whether you've ever had an infection in the past or whether you could get infected in the future. So it doesn't tell us whether you're immune to the disease. There is a test called an antibody test or a serology test. It's a blood test. And if you're positive, it typically means that you were infected sometime in the past and that you're very unlikely to get infected again in the next 3 to 6 months, maybe even a year.
Thank you for that answer. Thanks for the question and the answer. Our next question is from Carol. Christy.
Yes, hi. Thank you so much for doing this town hall. We all appreciate it. My question is regarding masks. Is Maricopa County planning on, at any point, educating the public on which mask types are more effective than others? As an example, I saw someone in the grocery store the other day with a crocheted mask made of yarn with massive holes, which is completely ineffective. And I've seen people with bandanas that are just kind of flapping in the wind. And I think at the beginning of all this, when masks weren't available, it was okay to just use what we had, but at this point it seems like masks are more available, and we know that there are some that are more effective than others. So is there any plan to perhaps educate the public on which masks are better, which masks are not as effective, and what we should definitely not be wearing, which is things like crocheted masks?
Well, and Christy, I'll add too, I recently saw a guy just walk into a store holding his shirt up over his face. In the same vein of what you're talking about. So, Dr. Sunenshine, would you like to take that question?
Yeah, thank you, Christy. Actually, we've been getting a lot of questions about types of masks, and just today, Maricopa County put out it's an infographic on the different types of masks and which ones are more effective and less effective. And as you said, it really does matter what kind of mask you wear. And here's what we know. We know that masks that have material that's tightly woven, which is not the knitted or crocheted mask that you just described, and masks that are multiple layers are much more effective. Typically cotton or a cotton blend is what is recommended. There was a recent study. It was not a large study, but it did look at bandanas and neck gaiters. And although it was very small, it did demonstrate that those are probably less effective than other masks. So for people who are wearing neck gaiters or bandanas, we would recommend that they fold them over several times so that there's multiple layers of material. And of course, it's always important for any mask to fit tightly around both the mouth and the nose with no significant gaps, because the germs will just find those holes right around your mouth and nose. And then the last one that we see a lot are those ones that look sort of like gas masks that have valves on the outside. And whenever you see a valve on a mask, I think of that as a really great way to infect other people, because what it does is it takes all of the germs and it shoots it out a very narrow valve. And as you know, masks are most helpful in protecting the people around you, but if it has one of those valves, it actually can cause more harm than good. So we ask that you not wear those.
Thank you, Dr. Sunenshine, and thank you as well, Director Flanagan, for being with us this evening. Really appreciate everyone's time, a lot of great questions. And I just want you to know that at Maricopa County, we really are focused, working with the experts here, to address COVID-19, not only the health impacts, but also the impacts on our economy and our lives. And so if you'd like to learn more about what Maricopa County is doing, please go to maricopa.gov/coronavirus. You'll be able to get information about the efforts that we're doing to help people who are suffering right now as well. You'll find testing information there and actually rates of infection and spread by zip code and by school district. So again, thanks so much for your time this evening, and stay safe out there.